Nuqaqsuti mi Antonia Olga de Coa.
Nuqaqsuti Paulina Puma Walpa.
Guataita 34 años.
Guataita 15 chuntas sorteo. Guataita kashan.
Nuqa qowi uya mandate ka kun qowi ta uya ni mana.
Seikuna wawaita mantin uyakun.
Antes qowi karanch kunan qowi uya mandate ka.
The Graduation from Extreme Poverty Pilot Project in Peru is being implemented by Plan International and Arariwa. This is in partnership with and based on a model designed by CGAP, the consultative group to assist the poor of the World Bank and the Ford Foundation. The project seeks to target the extreme poor and break the cycle of poverty. In 8 countries, 10 pilots based on this model have been or are being developed, with Plan International implementing them in Peru and Honduras. In Peru, the project has been carried out in remote villages in Cusco by Plan International, with the savings and credit component implemented by the microfinance organization Arariwa. Graduation is defined as the process which families living in extreme poverty manage to improve their self-esteem, skills and income-generating capacity. Step by step, they create a stable income, which includes access to markets where they can sell their products. This in turn allows them to purchase better food for improved nutrition, especially for their children. It also improves their overall living conditions at home. They also develop better financial skills, start saving and become eligible for credit.
Negociatrox pekarane asnapa kunat apamuspa sanap kuchikunachi azúcar ancha kunat rantimus pechi kunat 20 korahkana 10 centimes mañana gana yakos.
In 2010, the lives of 828 of the poorest families from the 43 poorest communities in the provinces of Acamayo and Canas in Cusco began to change for the better. After 3 years of hard work, 80% of the families who stayed with the project have graduated. This means that they have significantly improved their living conditions and are better able to support their families, especially their children. As a result of their improved or new income-generating activities, on average the family income has increased by 125 soles per month. This represents an increase in household income of approximately 30%.
Rutata ranti mun alimentación ni kuna tiana pan mana cosa ilan kam je nunca siana pan je.
Jeman ta limpia sakan. Se hoy ko imena so iwana ikchi kuna te ya cheiko. Nai kuna taps wasitaps mejorane embargo.
To provide these families with effective pathways out of extreme poverty with success, the careful sequencing of the following steps had to be ensured. First, agreements were reached with the participating communities to transparently identify which families were the poorest of the poor. The second step was to give these families, usually the mother, a time-bound monthly stipend of 100 soles. Families were told this would only be for a 9-month period and were encouraged to use it for childcare and improve their family diet. The stipend was provided to mitigate the stress of day-to-day living needs. Now they can focus on learning new skills and building more productive economic activities. Then, Plan worked with each family to identify a vision for how they wanted their life to be. This included identifying the type of small business they would like to run to help improve the condition of their family. Plan took into account both the local market context and the interest and abilities of these families. These abilities were strengthened through training and support, and small enterprises were established that could generate income in the short term. Enterprises such as breeding and selling guinea pigs, breeding chickens to sell eggs, and the processing of dairy products, amongst other activities. These products could also provide a source of nutrition for the families.
800 grams, 700 grams, anje koi kunata vendin 15 soles, ma ton kunata kilo pisat 20.
To ensure the efficiency of this business plan, each family received technical support and materials for their business, for example, animals or seeds. The average value of this material support for these businesses was about 900 soles per family. Throughout the process, the families received intensive personalised training and assistance in the management of their economic activity. Equally as important, they received coaching on personal and social skills, with an emphasis on child, health, home care and financial education, all of which was conducted using an approach of learning by doing. As a result of the project, families have learned about eating better, with a varied and more nutritional diet. They increased household income through viable entrepreneurial activities. They are saving, accessing and making use of financial services. The living conditions of their homes have improved. Additionally, they have strengthened their life and social skills with better self-esteem. They improved communications and harmony in their homes and in their communities, thus promoting an environment of good treatment, with improved abilities to care for the health and well-being of their children.
Estos esfuerzos los seguiremos haciendo en bien de los niños y niñas de estos hogares, como también de los niños y niñas de todas las comunidades ámbito de proyecto.
Almost 60% of the population of Cusco live in poverty or extreme poverty. We hope to build on the success of this project by using this proven methodology. This will improve the lives of more families living in extreme poverty, and especially those of their children, knowing that a better life today can fulfill their potential to have a brighter tomorrow.